So Watikap, friends, colleagues, excellencies, guests here in person, as well as those dialing in from across the region. My name is Julian Bowen. I work here at the Embassy in Bangkok. And on behalf of my colleagues, I'm very pleased to welcome you here to a special Women's Month panel on the interlinked nature of women's economic empowerment, gender-based violence, and sexual and reproductive health and rights. We're very fortunate today to have a very strong panel here with us in person and also dialing in, and we look forward to a wide-ranging discussion on this very important issue. Now, without further ado, I'll pass to Alan McKinnon, Australia's ambassador to the Kingdom of Thailand, for some opening remarks. Ambassador.
Good morning, everyone, and good morning to those. We're grinding into our second year of a pandemic. It's great to see people come out and actually join an event live. I do want to say we've got a lot of space. No one should be sitting next to each other. You should be 1 seat away. So proper social distancing. I don't mean to be a nag. And welcome as well to those who are coming in from afar, and including old colleagues like Julianne Guevara, who we work together. So hello, Julianne, how are you? And hello, everyone else. As we near the end of Women's Month 2021, it's timely to reflect on UN Women's global theme for International Women's Day this year. And that's women in leadership, achieving an equal future in a COVID-19 world. Now, many of you who are familiar with Thailand would know that women have been on the front lines of the fight against COVID-19 here, as they have been around the world. But it's especially true in Thailand because one of the sort of special features of Thailand is the 1 million village health volunteers, almost all women, but certainly predominantly women, who have worked tirelessly for months to keep their communities safe. They rule with an iron rod, and Thailand has benefited from their prestige and their authority within their communities. We all also know that it's women and girls who've been amongst the groups that have most been affected by the social and economic consequences of the pandemic. And that's because women are most likely to work in the informal sector, to work part-time and in positions with less job security, or work in sectors that have been hardest hit by the pandemic, like tourism, hospitality and retail. Last Thursday, Friday, I was in Phuket, and over 2 years, average per capita incomes have gone down from 37,000 baht to less than 2,000 baht. These are people working in the tourism and the informal sector. Their incomes and livelihoods have been smashed, and it's like that around a lot of places in Thailand. And finally, we know that women must play a leading role in the recovery from this pandemic. This isn't just a matter of justice and equality. There is overwhelming evidence that businesses, organisations and governments work best when we have diverse leadership. We could do with some more diverse leadership in Thailand. This is why we are advancing gender equality and the empowerment of women and girls, and that's why it's such a focus of Australia's diplomatic development and regional security efforts, not just in Thailand, but throughout the Indo-Pacific region and around the world. And we do so hand in hand with the national and international partners, not least UNFPA and CARE Australia. So together with my colleague, Bjorn Andersen from UNFPA, I'm very pleased the Embassy is hosting this panel with Australia's Ambassador for Gender Equality, that's Julianne up there, Julianne Guevara, Peter Walton from CARE, and Dr. Chanati from Chulalongkorn University. So Bjorn, that's over to you.
Thank you so much, Ambassador McKinnon, and for welcoming us to this very important meeting. And Your Excellencies and colleagues, ladies and gentlemen, a very warm welcome to all of you. And on behalf of UNFPA, it gives me an immense pleasure to be part of today's event. And we are all gathered to celebrate International Women's Month. And the theme for this year's Women's Day and Women's Month is Women in Leadership, Achieving an Equal Future in a COVID-19 World. This gives us an opportunity to celebrate the tremendous efforts by women and girls in Asia and the Pacific, and indeed around the world, in shaping a more equal future and recovery from the pandemic, and several of whom are present here today in our panel and in our audience, both virtually and in person. And we applaud and celebrate all the women leaders in the front lines of the COVID-19 epidemic, midwives and other health workers, social workers, psychosocial counselors, hotline operators, and community volunteers, all of whom have found new and innovative ways to reach women and girls in need, providing life-saving services despite the stringent restrictions imposed by pandemic-related prevention measures. Women leaders and women's organizations have demonstrated their skills, knowledge, and networks to effectively lead in COVID-19 response and recovery efforts. They have made irreplaceable contributions that have benefited millions. COVID-19 has also brought to the forefront the numerous challenges women face in truly exercising their agency and autonomy in taking the charge of their own health and in shaping their lives. We have seen a rollback in hard-won advances in women's rights. In particular, the pandemic in so many ways has pressured women's bodily autonomy even beyond the pre-existing gaps. New evidence from UNFPA shows that as many as 23 million women may not have been able to obtain contraceptives, leading to as many as 2.3 million unintended pregnancies. When it comes to gender-based violence, it has been difficult, if not impossible, to conduct robust prevalence data requiring in-person surveys that respect the safety and confidentiality of respondents. But a recent UN Women and UNFPA big data analysis of online searches and social media content in 8 Asian countries clearly points to a significant escalation in gender-based violence amid pandemic lockdowns and other restrictions, something UNFPA had predicted at the outset of the crisis. The UNFPA CARE Australia collaborative paper that will be discussed today highlights that we cannot divorce the exercise of power and control over resources from women's ability to exercise control over their bodies and live a life free from violence. By understanding the links between women's economic empowerment, gender-based violence, and sexual and reproductive health and rights, we are better positioned to ensure a solid foundation for empowerment overall. In the words of the UN Secretary General, and I quote, "Gender equality is essentially a question of power, but equal power will not happen by itself. Women have an equal right to speak with authority on the decisions that affect their lives. This is how we will ensure that decisions are inclusive and reflect the needs of the entire population. This is how we will rebuild from a pandemic that has made gender inequality worse, that has pushed women into poverty, out of jobs, and away from access to educational and medical services, including for sexual and reproductive health. This is how we will solve the urgent challenges of our time, from the pandemic to climate change, to deepening inequalities, conflict, and democratic backsliding," end quote. Throughout the COVID-19 crisis, women have kept entire societies going, sustaining health systems as the majority of frontline workers and courageously managing extra responsibilities at home in caring for the ill as well as children out of school. They have kept open shelters for survivors of gender-based violence, and they have scaled mountains, often literally in remote and isolated regions, to distribute contraceptives and other essential supplies and medicine, who have made us get this far in the struggle to combat COVID-19. Our collective response will constitute an important pillar of efforts to strengthen gender equality and the health and well-being of all women and girls, and the most vulnerable in particular. contributing to help ensure that in the vision of the SDGs, no one is left behind. So finally, again, allow me to thank Ambassador McKinnon and the Australian Embassy for so graciously hosting this occasion, and for Australia's unstinting support to UNFPA through thick and thin. And I thank you.
Thank you, Bjorn, Ambassador McKinnon, for those opening remarks. I'm pleased to invite forward Sujata Tulada now. Kun Sujata is the UNFPA's gender-based violence technical specialist.
Your Excellencies, dignitaries and colleagues, a very good morning and afternoon to those of us joining us virtually. It is a true honor to be part of this event today and to be able to share this joint paper that we've jointly developed with CARE Australia. And before I go further, I'd like to take a moment to introduce my co-presenter today, Mr. Peter Walton, Chief Executive Officer, CARE Australia, who's joining us virtually, and you saw him earlier in the screen before. And I would also like to acknowledge the co-authors of this paper, Dr. Anu Munkur, former head of gender equality at CARE Australia, Mylene Nguyen, gender and social inclusion advisor at CARE Australia, and Ingrid Fitzgerald, former gender advisor at UNFPA Asia Pacific Regional Office. Now, this working paper draws upon the country-level programming that both UNFPA and CARE are doing already in the Asia Pacific region under our respective gender equality frameworks and strategies. Therefore, drawing on these programmatic experiences and on a rapid review of existing literature, what we have attempted to do here is to propose a conceptual framework for advancing gender transformative programming through the interlinkages between women's economic empowerment, gender-based violence, and sexual reproductive health and rights. Now, what do we mean by gender transformative programming? A true gender transformative programming takes a holistic approach to addressing gender-based violence, advancing sexual reproductive health and rights as an integral part of women's economic empowerment programming in order to eliminate inequalities and advance women's empowerment. And this is only possible when women and girls are able to make decisions for themselves without fear, have agency, access to and control over resources, and autonomy over their bodies, and are able to exercise their voice with an enabling environment where structures, systems, and institutions are responsive to their self-defined needs and priorities. Another crucial issue at the heart of gender transformative programming is addressing gendered social norms relating to women's participation in the economy, sexual reproductive health, and gender-based violence, and women's productive and reproductive roles and responsibilities. It's also important to note here that women's economic empowerment has graduated from being solely focused on economic concerns such as income generation, labor market participation, and financial markets to recognizing the importance of women in all their diversity, having agency and power and control over resources to meaningfully participate in decision-making. And programming on preventing gender-based violence has also enhanced an understanding of the use of violence as a deliberate strategy to exercise power that keeps gendered hierarchies in place. And here we try to unpack these interlinkages a little bit. It can be a little bit crowded here, so let me give a quick overview. So it is increasingly clear that women's economic empowerment, gender-based violence, and sexual reproductive health and rights are interlinked and interdependent. We've already heard about this morning already. We cannot divorce the exercise of power and control over resources from women's ability to exercise control over their bodies and from living a life free from violence. So now looking at the linkages between gender-based violence and women's economic empowerment, this relationship can be a bit complex. We used to have an assumption that if we empower women economically, that would automatically reduce women's risk of violence, but that is not always the case. On one hand, improving women's financial autonomy, bargaining power, and self-esteem can reduce risk of violence and allow women to leave violent relationships. At the same time, research shows that engaging in employment can also exacerbate the risk of violence, challenging power dynamic at household. Gender-based violence can also impact women and girls' ability to complete an education, limiting their economic options. It can also lead to loss of income due to loss of days at work or health-related needs. And workplace sexual harassment specifically can impact occupational well-being and women's ability to work. Now, looking at the interlinkages between sexual reproductive health and women's economic empowerment, this interdependence is also recognized in the Sustainable Development Goal framework. And we know that girls have to drop out of school early due to early marriage and early pregnancy. And of course, that limits their economic opportunities. When women cannot have control over their bodies and use of contraception, there can be multiple unintended pregnancies and again, limit their women's economic empowerment and particularly economic opportunities. Women remain concentrated in informal work due to domestic and unpaid care responsibilities. And during COVID times, we've seen quite a bit of that manifest where women have had to make that choice. Often women are unable to access the sexual reproductive health services due to paid and unpaid work responsibilities and job insecurity as a result of lack of adequate policies such as parental leave. And finally, looking at the interlinkages between gender-based violence and sexual reproductive health, GBV or gender-based violence can often be used to dominate and intimidate or even reinforce gendered inequalities. And you can see some of the manifestations here in the form of reproductive coercion, violence in pregnancy, etc. Violence can also be linked to a variety of negative health outcomes for women, such as unintended and early pregnancy, pregnancy complications, and increased risk of sexually transmitted disease, etc. I think it's also important to mention here that while the links between gender-based violence and sexual reproductive health may seem obvious, in our experience, very few programs explicitly make the link. So finally, to summarize this complex picture here, by linking women's economic empowerment, gender-based violence, and sexual reproductive health and rights in our programming, we can offer a solid foundation for empowerment overall. And now for some thoughts in terms of how to apply this conceptual framework of interlinkages, I will hand over to my co-presenter, Peter. Peter, over to you.
Thank you very much, Sajata. Look, there is a lot to convey in this presentation, so that the link to the full report will be provided at the end. But I'm really excited to be talking about this joint work with you all today. And I guess what I'll focus on is, what do we know through our experience through CARE and UNFPA around what works? I think this report was written just prior to the global pandemic. So I think I'm going to spend some time reflecting on COVID-19 and the concept of building back better. And then I guess I'll finish on, well, what next? I think just interpreting the type of people attending this event, I think many of us will think back to Beijing in 1995. And the progress or the limited progress that's been made globally. So what does need to come next to make progress in terms of gender equality, women's economic empowerment, gender-based violence, and sexual and reproductive health and rights? What's going to be different so that we are doing things differently? So drawing on evidence from CARE and UNFPA's work in the Asia-Pacific region, a rapid review of recent literature, the working paper really does make a case for a much more holistic approach to women's economic empowerment programs that better integrate gender-based violence and sexual and reproductive health and rights issues. We are learning through our experience that where programs are gender integrated, which means they include all of those components, and when programs work across the broader gender equality framework that CARE has in place and UNFPA, greater change is achieved. So in many respects, understanding this, it becomes a question around why aren't we doing more of this? But we're going to share some examples and also in the upcoming panel around where this is really working. Capacity development programs that go beyond employment skills to include sexual reproductive health and rights and GBV modules, all have a significant impact on the overall attitudes towards empowerment and improve women's awareness of sexual reproductive health and rights. The Women in Factories training program, an initiative of the Walmart Foundation, their Women Economic Empowerment program, and CARE, we included health and nutrition among core training modules, in addition to modules on functional literacy, personal finance, communication, gender, social status, and relationships and leadership. Although the program didn't include a core focus on sexual and reproductive health and rights, an evaluation of the initiative found there to be an impact on women's factory worker attitudes towards birth spacing. We also have great experience coming from our program Sewing for a Brighter Future, a project based in Cambodia, and it's an initiative of the Levi Strauss Foundation. This also focused on skills development for worker well-being, including a module on sexual reproductive health and rights. These sessions increased women's awareness of different contraception methods, ability to identify at least 2 risk behaviours related to HIV, and knowledge about sexually transmitted infections. Next slide, please. So, as I said, this report, I joined CARE January last year. Wasn't quite expecting my first year to pan out the way it did, but I think we can all say that for 2020. But, you know, I think it was prepared at a time where we didn't fully anticipate what was coming. And the effects of the COVID-19 pandemic have been huge and continue to be huge, but none more so than the disproportionate impacts on women and girls. So this crisis, in my mind, provides us with a unique opportunity to look forward and the concept of build back better. We must promote the economic, social, and political empowerment of women and girls by supporting economic empowerment, supporting livelihood programs, supporting social protection and safety nets that support women and girls to access and have safe and equitable access to education, for girls and for boys. This importantly also includes promoting the leadership and meaningful participation of women and girls in all levels of decision making, where they today remain conspicuously absent. And I think even when we've looked at the response to COVID-19 globally, the absence of having representation from women is all apparent, but there's a growing body of evidence that shows where women have been actively involved in all levels of decision making, quite frankly, the response has been much better. So at a time when economic recovery along more equitable lines will be critical, investing in women and their economic empowerment provides a real opportunity to accelerate economic growth. And this is needed to rebuild the economies and to recover the financial systems. Research from the last 5 years has shown that investing in gender equality can benefit the economy as a whole. If women participated in the economy as much as men, their activity could add an additional $28 trillion or 26% of global gross domestic product. And according to the World Bank, achieving gender equality in employment would reverse losses to global wealth of 160 trillion. The ambassador at the start referenced the number of women in frontline formal and informal healthcare work. You know, actually understanding how investment in women is good for everybody is something that has largely been absent in a lot of decision making. So what should come next? So firstly, I would say goodwill and rhetoric around gender equality and women's economic empowerment is not enough. We need a new commitment to gender transformative change. The world is awash now with reports and challenges, but I'm hopeful that if we continue to build and listen together and reshape our programs and policies, as outlined in these reports, we can bring gender transformative change. But it isn't business as usual. It isn't doing more of what we've done before. It's actually taking some bold efforts to change. Gender inequality, as we know, is a key driver of poverty and one of the most widespread forms of injustice in the world. Gender equality will never be achieved while women have fewer economic rights, less control over economic resources, and less access to economic opportunities than men. It is fundamentally an issue of social and economic justice. It is fundamentally an issue of power. We cannot divorce, however, the exercise of power and control over resources from women's ability to exercise control over their own bodies and live a life free from violence. These two things don't run in parallel, they're inextricably linked. By understanding the links between women's economic empowerment, gender-based violence, and sexual and reproductive health and rights, we are better positioned to ensure a solid foundation for empowerment overall and overcoming injustice and inequality. As I mentioned before, post-Beijing, 25 years later, I think we would all say that the progress has fallen well short. What got us to this point is clearly not enough to get us to where we need to be. So the next thing I would say is that to prevent the COVID-19 pandemic and its economic and financial repercussions from reinforcing gender equalities, or worse, derailing decades of progress on women's and girls' economic justice and rights, the global community must take decisive and equitable action now. This global health crisis holds an opportunity to rebuild systems and societies in a much more equitable way, in a much more inclusive way, but only if gender equality is put at the heart of and center of economic and financial response and recovery. Globally, we need to stop just treating only the symptoms of gender inequality. We need to be taking decisive action to really address the root causes. And again, I think we have fallen short. And CARE has recently, albeit in the context of humanitarian work, produced a report looking at the efforts of governments globally and their gender equality commitments. And pretty much all of them have fallen short despite good intentions. So addressing gendered social norms relating to women's participation in the economy, sexual and reproductive health and rights, GBV, and women's productive and reproductive roles and responsibilities are all fundamental for gender transformative change. So in short, I would say national governments, international and regional decision makers, business partners, the private sector, all have a role to play in terms of prioritizing equality and prioritizing women and girls in their socio-economic responses. So this is integrating a gender lens through the economic response. It is absolutely about prioritizing women and girls because it's the right thing to do and because they are the agents of recovery and change that the world needs, both short-term and long-term. But this does require bold action. It requires political will, and it requires more resources being channeled into the things that are going to make a difference. It is time for a better bargain. It is time for a better bargain for women and girls globally. Thank you.
Thank you very much, Peter, and thank you for all of us who have joined us for this conversation. The full paper is available on our website, and the link will also be posted on our YouTube channel for those of us who are joining us on YouTube. So with that, thank you so much, Peter. I hope you're staying along because we'll have some more questions for you as we go further in this conversation. And with that, we will move to the panel discussion part of the event today, where we will attempt to understand how this framework that we've discussed today of the interlinkages between gender-based violence, sexual reproductive health and rights, and women's economic empowerment applies in the COVID-19 context and what we have learned so far. So I'd like to start by introducing our panel today. We are very honored to have a range of experts and practitioners who've joined us today, both virtually as well as in person. So first of all, I'd like to introduce Her Excellency Ambassador Julian Guevara, Australia's Ambassador for Gender Equality, who's joining us virtually from Australia. Welcome, Ambassador. We also have Dr. Tabinder Siroj, Country Director for Pathfinder International in Pakistan, who's also joining us virtually from Pakistan. Welcome, Dr. Tabinder. Next, we have Ms. Verena Morn, Senior Program Manager for Dignified Work and Life Free from Violence, CARE Cambodia, who's joined us virtually as well. Welcome, Verena. And last but not the least, we have Dr. Chanati Tinam, lecturer and member of Management of Faculty for Communication Arts at Chulalongkorn University here, and also member of the National Committee for Unfair Gender Discrimination under Gender Equality Act. And we have the honor of having Dr. Chanati Tinam here with us in our audience. So Dr. Chanati, if I can invite you to join me at the table here, I really appreciate that. Thank you. Bear with us as we try this hybrid model. So might take a little bit of trying out here. So with that, let's start off. Again, thank you very much. I'm so tempted to look behind me, but I will not. Thank you very much for everybody who joined us here in person and also all my panel members today. Maybe we'll start with Ambassador Julian Guevara with the first question. Just to recap that we'll have 2 rounds of questions today, time permitting. So Ambassador, it has been over a year of COVID-19 pandemic. As Australia's ambassador for gender equality and in light of the presentation today, we'd love to hear your observations on how the pandemic has impacted women and girls, and also any thoughts you may have on how we can ensure that women and girls' needs are met holistically in the recovery. Over to you, Ambassador.
Thank you so much. And I did want to, first off, register my appreciation, of course, to the Australian Ambassador in Thailand and to UNFPA for organising this event. In fact, yes, obviously it's in part to celebrate International Women's Day, but it is, I noticed from the title, a month of celebrations. And in fact, for many, of course, we have just left the negotiations that happened last week at the Commission on the Status of Women, which looked at some very important issues around, of course, women's full and effective role in decision-making in public life, you know, an issue particularly topical now, I suppose, to some of the issues that we are experiencing through COVID-19. And I've just left earlier this morning an event for generation equality, which is happening in Mexico City at this very point in time, partly trying to capture, I suppose, what has happened since Beijing 25 years ago with the Beijing Declaration and Platform of Action, and what are the next steps, particularly now, you know, in a COVID-19 world, and how do we ensure that gender equality is part of the Build Back Better process, as Peter mentioned. It's interesting for me because, like Peter, I started in this role a little over 12 months ago myself as the Ambassador for Gender Equality. And of course, that's coincided with this time of COVID-19. And I mean, from the very early sort of rapid assessment data that was coming in about the impacts of COVID-19, we did see obviously that it was exacerbating inequalities, and particularly gender inequalities. I mean, UNFPA had put out data very early in the piece predicting, you know, that there could be an additional 31 million cases of gender-based violence as a result of pandemic triggers. And certainly, you know, we have seen, in fact, those spikes in gender-based violence as one of the effects of the pandemic. Looking at the employment issues, I think, as Ambassador McKinnon said, I mean, impacts on sectors which are highly feminised in terms of their workforce, whether that's hospitality and tourism to retail. Those issues have been prevalent not only in Southeast Asia, but for many of our partners too in the Pacific. You know, where some in the Pacific instance, I mean, a number of countries haven't had, you know, a single case of COVID-19, but as a result of having to shut down, you know, their economies to things like tourism, international tourism, you know, women have been quite significantly affected in terms of their employment. So through all of this rapid assessment, I think, you know, the Australian government recognised very early that there would be significant impacts on women, which is why, as part of our development response to COVID-19, of course, the government announced a strategy called Partnerships for Recovery. And that Partnerships for Recovery policy really did identify the issues that we're talking about today. So trying to ensure that we maintained the provision of essential services on gender-based violence at this time, when we saw health systems around the region being impacted by COVID-19, knowing, of course, that there would be health resource dedicated, of course, to dealing with the virus, which may, of course, mean that on important issues like sexual reproductive health and rights, there would be a need to try and ensure that we continue to provide services on the SRHR front as well at the same time. On the women's economic empowerment piece, I mean, women's role in economic recovery will be really crucial. I mean, Peter just cited, of course, the very famous McKinsey's Global Institute study that was done back in 2015. Interestingly, McKinsey's Global Institute did an update of that study during this current crisis, where it suggested that, you know, if we don't take into account sort of gender responsive responses to the current crisis, we could see, you know, that trajectory in terms of economic growth. We could lose $1 trillion in gain. However, if we maintain a higher focus on gender responsive responses to the crisis, yes, we could be well back on that trajectory. And I think they've now cited figures of, you know, $30 trillion increase in GDP by 2030. So there are clear benefits for us having a gendered response to the crisis, and it very much has been informing, as I said, our approach to the COVID-19 response that we have been delivering. In terms of some of the specifics, examples that I could share with you today, just in terms of some of the work that we have been doing. It's interesting, I heard there was another panelist from Cambodia. We have a program in Cambodia called Access, which has primarily for a number of years now been responsible for the provision of gender-based violence services. But we realised during this particular crisis that ensuring the health of those workers was particularly important. So provision of PPE at the same time, and to ensure that they could continue to provide essential services. We're working with a program called Nabilan in Timor-Leste, and also with the government of Timor-Leste. Again, making sure that women's shelters have stayed open and COVID-free at this stage was particularly important. We have a program called Investing in Women, which of course is one of our flagship initiatives on economic empowerment of women. We've had it operating for a number of years now, going back to 2016. During this particular crisis, however, you know, making sure that we could ensure that those women's SMEs in the region continue to have access to financing when that was really under threat. All of those issues, I think, have been really important in terms of pivoting existing programs that we have. Some of the work that we already do with CARE in PNG, for example, has this combination of looking at women's economic empowerment and issues around voice and agency and leadership. I'm thinking particularly of one called, which is happening in PNG at the moment, called the Coffee Industry Support Project. That's to support the coffee industry stakeholders to mainstream gender equality in their policies, practices and approaches. But it's also provided for increased women's access to agricultural extension services. It's improved the business management of those farming families. And what you have seen is, of course, as a result of that, women involved in sort of key decision-making areas, not only in relation to that particular industry, but also then, of course, having an influence on decision-making of their communities more broadly. Similarly, we have programs in the Pacific like Markets for Change, which we do with UN in collaboration with UN Women. And it's a similar scenario where basically we have been supporting women's participation in local markets. But what we have seen through that program is women participating then on the vendor board associations, which has allowed them to have voice and agency in terms of making key decisions, not only around their own livelihoods, but in fact the livelihoods of their communities. So these sort of transformative programs, which have been highlighted in this study, are very much the type of approach that we in Australia through our development assistance program are wanting to take. I have heard a number of the kind of interventions today, I think have been very thoughtful in sort of the challenges ahead, but I think there is this opportunity at the moment for us to take the pandemic and its effects and really to think about how we deliberately take actions to build back better. And so I am a bit of an optimist in thinking that, this really has brought attention to some really critical issues, across the region on how we improve gender equality. Because in fact, when we talk about, the challenges that we face, whether that's, insufficient economic opportunity for women or gender-based violence, underpinning all of that, of course, is the need to kind of address the gender inequalities that exist through changing, social and cultural norms. I'm hoping we're at a point now where there is sufficient attention on this issue of changing those social and cultural norms that will help us to come out of this pandemic in a better state on the trajectory in terms of gender equality. So I might leave it there in terms of a first introductory comments. Thanks.
Thank you so much, Ambassador. That was quite extensive, and you've given us a very clear sort of idea of what benefits there could be, and also brought in a bit of optimism in terms of building back better and what the COVID-19 context also allows. And thank you also for sharing for all these practical examples of transformative programming that's happening in Asia Pacific. We'll come back to you for more on that, Ambassador. So for now, I would like to move to Dr. Tabinder. Dr. Tabinder Saroj from Pakistan, Country Director, Pathfinder. So Tabinder, you have worked extensively to promote women's empowerment at advocacy and programming level in Pakistan and regionally. In the context of Pakistan, how have you seen these issues evolve? And also with the experience of COVID-19, how has that helped accelerate this greater convergence on these fronts? Over to you, Tabinder.
Thank you so much, Sujata. Please let me know if you can hear me.
All good. Go ahead.
So thank you for that introduction. Indeed, it has been a learning curve for practitioners like me, but an insight across the context that I've worked is exactly what you have just said in your working paper. Gender inequality and its resultant skewed power dynamics are the root cause of gender-based violence and unequal access to SRHR and unequal access to economic opportunities. As the paper mentions, women's sexual and reproductive health and women empowerment are interlinked and interdependent, and access to health, justice, education, and livelihoods are key determinants, of women empowerment. For a country like Pakistan, where I've been devoting 70% of my time for the last 5 years, the dynamics remain complex in the backdrop of devolution of fiscal and administrative powers to the provinces, amid tremendous security and political challenges. Case in point is the age of marriage law, which in one province is 18, and in the rest is still 16, following the colonial Child Marriage Restraint Act. The progress and approaches have not been uniform, and hence key women empowerment and health indicators remain stagnant. For example, the contraceptive prevalence rate that has hovered around 25, according to the last 2 demographic health surveys, despite a significant unmet need. The Domestic Violence Act, the Reproductive Health Act, the Act for Women's Harassment at Workplace are all positive policy advancements. The implementation, however, remains riddled with procedural obstacles, lack of capacity and awareness, and lack of trickle-down of the higher-level political will. The health workforce of Pakistan largely consists of women as lady health workers, facility and community-based midwives, and family welfare workers. While these jobs have provided economic security to hundreds of thousands of women, we seldom see women in health management and leadership positions. Also, the lack of gender mainstreaming within the departments has prevented gender-responsive services to women, services that consider social and gender determinants of health. Community midwives are another cadre that often find themselves struggling to set up their businesses and end up taking jobs as paramedics, not necessarily confined to reproductive health. The government of Sindh is introducing a 3-year intervention that aims to empower community midwives economically and support them in not only providing reproductive health services, but also education to their communities. This is a good news because in COVID-19, many community midwives suffered economically due to lack of resources and support. So through Naya Kadam, a project supported by Bill and Melinda Gates Foundation in Pakistan, Pathfinder is working with providers and health workers who were taken through a learning journey that included gender sensitization, awareness about human rights, in addition to competency building to provide reproductive health services, including post-abortion care. This entailed the implementation of the national guidelines of uterine evacuation and post-abortion care, another example of a policy that awaits implementation at scale. Later, in partnership with Unfpa, selected providers from the same cohort were trained on gender-based violence and how they could become first responders and referees for survivors. We already knew that health providers often the first service a survivor of domestic and sexual violence approaches. During COVID-19, the anecdotal data strongly suggested a rise in domestic violence. Here, I'm reminded of Fahmida's story, a lady health supervisor from Shahid Benazirabad. Hailing from a poor rural family, she was married off as a child when she was in grade 8 and gave birth to a baby in grade 10. She overcame spousal abuse and opposition and took a stand. After divorce, she continued her education and work and also cared for her family and the household. Today, she is a supervisor of her peers, a respected master trainer, and a COVID-19 frontline worker, as well as a community champion against gender-based violence. And if you want to learn more about her, of course, please feel free to look at our website. But COVID-19 did provide us eye-opening lessons. Women's and girls' mobility decreased further. A record number of girls and boys dropped out of school, and access to reproductive health services decreased. At the same time, institutional resilience was put to a tremendous test. However, for the first time, we saw provincial and federal governments upping their game. FPRH guidelines were developed. Digital platforms such as WhatsApp and Zoom were activated to provide supportive supervision and mentorship to providers. Community social and behavioral change communication campaigns and remote services and counseling through telemedicine also started. However, regularization of such services through a strong policy framework is still a question mark. The planning and development departments have recently initiated multi-sectoral planning and review meetings, but much more needs to be done so that gender transformative approaches become an integral part, not just for policy making, but for implementation. Thank you, and I'll hold myself here for your next question.
Thank you, Dr. Tabinder, and thank you for so much bringing us the focus, for not just in terms of pushing for policies, also looking into how to make the implementations happen and giving us this real challenge of how, when the implementation is not focused upon, there becomes this vicious circle where all the issues that we're talking about comes to life. Thank you so much. We'll come back to you for more. But for now, let me turn my attention to Dr. Thinam. Thank you so much for being here with me and giving me company as well. So Dr. Thinam, you've been a long-time advocate and activist for women's rights and gender equality in Thailand. Now, how far has Thailand come regarding gender equality, particularly from the perspective of the interlinkages that we're looking at today? And also, what have you seen under COVID-19 in terms of this wider public discourse on this? Over to you.
Thank you and good morning, everyone. It's an honor for me to be here and have a chance to exchange my idea with all of you. Since the era of the first wave of feminism in 1900s, Thailand comes so far in many points of gender equality and falls behind on many issues. As I am a member of the Committee of Unfair Gender Discrimination, which is a position under the Gender Equality Act 2015, I would like to raise you an example of how women facing with economic problems during the COVID-19, which is a complaint has been filed to the committee. In the past year, during the COVID-19 pandemic, 3 female employees of a private company filed a complaint with the committee. They were terminated by the company. The company said they were laid off because of the economic problems during the COVID pandemic. Therefore, the company has to reduce the number of the employees. Legally, if the employment is terminated because of the pandemic and it faces economic problems, it is reasonable enough in the view of the labor law in Thailand. But the female employees informed that the employers claimed that about COVID-19 in the fact that they were laid off because of pregnancy. In fact, according to Thai law, termination of employment because of pregnancy cannot be done. And at that time, all 3 females employers had already made maternity leave with the company in advance. But employer wanted to reduce staff, therefore they choose to lay off women who are very pregnant. So they will not be responsible for wages during maternity leave. Termination of the employment of all 3 women whose working terms are less than 3 years of employment. The employer has to pay 90 days of compensation. So the employer takes advantage of the maternity pay as a part of the compensation, causing employers to pay up to 50% less than before. This is a big problem about gender equality. The termination of the employment of women during their due dates without committing an offense and not foretelling is considered an unfair termination of employment. These women workers lack the benefit of maternity leave, lose the opportunity to find work as it takes up to 6 months for childbirth and childcare to become healthy for women to be able to work or to look for a new job. This is one of the economic problems in which women are discriminated against by citing the situation of COVID-19 and erasing the issue of gender prejudice against women in economic areas. Unfortunately, the Commission cannot accept this petition due to the regulations of the Ministry of Social Development and Human Security regarding the criteria and procedure for submission of 2015 gender discrimination consideration and decision, stating that if the matter was filed as a court case, we cannot accept the request. Because all 3 women choose to fight for their case by filing a lawsuit to the labor court and also submitting a complaint to the Commission all the same time. The process of the Commission must therefore be stopped and leave it to the labor court judgments to bring justice to the 3 female workers. If the process of judgment lacks gender lens, 3 women might be laid off without justice. And this is what I think is really important to make awareness, because it's not just COVID-19, but there are gender blindness. So I don't know. Now the process of the judgment is continuing. This is what the case that I would like to raise for the gender awareness for today. Thank you.
Thank you so much, Dr. Tinam. I think as you've mentioned, this really relates to what we're seeing in the report as well, that it's really an issue of social justice.
Yes.
And also how the COVID-19 has been used as an excuse to exacerbate existing gender inequalities and discrimination. Thank you for sharing that very touching and real story. With that, maybe I'll move to Borina, who joins us from Cambodia. Borina, who's a Senior Program Manager for Dignified Work and Life Free from Violence in Cambodia. Borina, you've been at the forefront of programming this integrated approach that we've been talking about today. In your observation, what have been some of the most effective strategies that have worked for you in this integrated model? And of course, it has not probably come without challenges. How have you overcome them? Over to you, Borina.
Yeah, good morning and afternoon to all. It is my honor to have my opportunity to present about the challenge and solution of CARE International in Cambodia programming related to women economic empowerment, gender at the heart of all we do. The access to equal opportunity represent a power and effective the opportunity to end the extreme poverty. Sexual harassment has a significant cost to the business, and the activity which are improve the worker health, skill, or overall well-being have a positive impact to the term of reduced turnover, reduce the absenteeism, and also increase the productivity. CARE has worked with the garment industry in Cambodia for more than 20 years. We currently working with 46 factories, and we reach to more than 40,000 workers in this year. 85% of Cambodia garment factory workers are women, and they are under 35 years old. Most of the women are the rural migrants to the urban center. They have limited education and low literacy. The lack of resource to plan live with the family that lead to unwanted pregnancy and unsafe abortion practices. The sexual harassment has become a significant compliance issue in the garment sector. When these women also experience sexual harassment, they will often close to lose their job. Nearly 1 in 3 women in the garment sector experience sexual harassment in their workplace. And absenteeism to turnover and productivity lead to affect the significant business costs. If the garment factory do not address this issue, the report of the supply chain harassment can be negative effect to the brand reputation. The new global legislation, in particularly ILO Convention 190 on ending violence and harassment in the world of work, will require the better compliance. And we call all the stakeholders to urge the governments to ratify this important convention, and it make the business sense for the factory to improve the compliance. Lack of the money management skill will prevent saving for the future. Nearly 40% of the garment worker household in Cambodia are in debt. A recent need assessment by CARE Cambodia at the start of the COVID outbreak found that the indebtedness is increasing significantly. So what are CARE solutions? CARE work focus on the women worker well-being and provide the compliance support to the factory and the strategic alignment. We have the same goal. We want the women have the safe place to work, and the garment sector also want to comply with all the law to keep their good reputation with the brand. The worker well-being program include intervention on the sexual reproductive health, including the well-known CHAT contraceptive project. It is a series of in-person training combined with the app to keep the woman and their spouse interested in this subject matter. For example, of this contraceptive. This program helps the woman to make better decisions. In the factory where the project has been rolled out, we found that the use of modern contraceptive double. It makes them double to use the health service, and it triple confident to refuse it. This all has a positive outcome on reduced absenteeism, reduced turnover, and increase the worker satisfaction. CARE also work with the prevention of the sexual harassment with the tool to effectively record report of the sexual harassment, train the HR staff and the sexual harassment prevention committee, and ensure the worker understanding of what behavior will not tolerate. A final example of intervention of CARE is the financial skill program. CARE improve the financial skill of the worker and we connect them to the future opportunity at the small business. Thank you.
Thank you so much, Marina, for that. I think we have time for one last round of questions, colleagues and panelists, if it's okay with you. And this question is to all of you. What lessons have we learned or are learning from COVID-19 pandemic that can be taken forward so we do not lose out on any gains that have made towards gender equality? Maybe we'll do the same rounds if Ambassador Guevara, if I can start with you.
Thank you. Yes, maybe just 2 quick points because I know, yes, others will have views on this as well. One would be, of course, which is the theme of the Commission on the Status of Women, which is about full and effective participation of women in public life and decision making. And I would apply that, of course, to responses and recovery plans for COVID-19. It was the Secretary General, of course, put out his report just ahead of CSW looking at women's involvement in public life. And statistics there suggest, obviously, we still have a really long way to go. I think it was only 10 countries have had a woman head of state, 13 a woman head of government, 119 countries have never had a woman leader. And according to his statistics, it'll take us another 130 years to achieve gender parity in decision-making in public life. If we want to have good policy and regulation which governs our response and recovery, we need to ensure, of course, that women are part of that decision-making. So that is point 1. Point 2 would be, of course, around the underpinnings of all of these issues that we've spoken to, whether that's economic inequalities or gender-based violence. Underpinning all of that, of course, is the gender inequality issue. And I think, clearly in Australia, we have recognised, over a course of a number of years in our policy settings now, the need to do more work on prevention, the need to do more work on changing social and cultural norms. And so I would hope that sort of coming out of this pandemic, there would be more focus on those issues. As we go about some of this work that we've been talking about here today, looking at the interlinkages of all of these issues in the programming that we do, whether that's through a development assistance or whether that's in our own policy making environments domestically. Thanks.
Thank you so much, Ambassador. Very clear. Tabinder, over to you.
Thank you so much, Sujata. I guess for us, our biggest lesson learned was that institutional resilience is a must to be agile and gender responsive in the times of unforeseen emergencies, such as the COVID-19. Health frontline workers are women from the communities, serving the women of the communities. And these cadres have a lot of potential to become the source of gender responsive services for women. Another advance that was made during COVID-19 was the increased access to digital platforms for women, both for education and for work. However, it's important to note here that cybersecurity remains a top issue for women and girls venturing into the cyberspace for livelihoods as well as for accessing help, especially in contexts like Pakistan. In addition, there is the gender divide in accessing the cyberspace as well. So it comes down to governments and programmers to connect the dots. The last decade has seen a steep internal migration towards the urban centers, which has impacted livelihoods and access to resources for women. COVID-19 heralded an era of a new normal, and a realization is setting in that policy, projects, and interventions in silos will not move the needle. Till empowerment in its true sense is seen as a women's right as an equal citizen of the country. This would require working and looking at women's agency holistically and simultaneously transforming the systems to become more transparent and enabling, and also change the relationship of women in the domestic realm as well as within communities and social, economic, and political arenas. This becomes even more important when we see the vulnerabilities associated with climate change. Pakistan is the 5th most vulnerable country for climate change, and socioeconomic repercussions are expected to be disproportionately high for women, girls, and children. It's important for policymakers and managers to focus on the SDG commitments and integrate these multiple considerations and realities in their work. Women need to be supported to claim their full potential in life. There is a need to involve men in making positive family decisions and as adopters of change, and to invoke the empathy and influence of local actors and champions to make the most of these opportunities. Thank you so much.
Thank you, Dr. Tavinda. That really was quite a summary. With that, I'll move to Barina, if you have your final points on the lessons learned.
Yeah, we know that the pandemic affects the women more than men, and this main concern is increase of the indebtedness of the female garment worker and their family. Care need assessment after the start of the COVID outbreak has shown that the indebtedness is increasing. So this is also lead to the exposure of the weak of the social protection of the even formal worker in the garment sector. So the government has come to realization that the social protection team need to be accelerated and increasing. And one of the main challenge of this intervention are the traditional social norm of the factory owner, HR manager, and co-worker. So the program need to address this norm, but of course, it takes time. Thank you.
Thank you so much. And while we have you, Peter, perhaps I turn to you now for your key points on this.
Struggling to find the mute button. Look, I would echo a lot of what many of the other panelists said, but if I can just highlight a few points, going back to all of the commitments that were made in Beijing, there's so many different areas that need addressing, whether we're talking education, whether we're talking health, violence, economy, etc. Something Tavinda said, it really resonates with me around, if you have a siloed approach, you're going to get siloed solutions and unintended consequences. And when we think about women's economic empowerment, there's, unintended consequences around, inadvertently increasing gender-based violence, or the co-option of income, or, poorer health outcomes. We have to take an integrated approach that really looks at how we address things more holistically and get momentum. And I think that lays down a challenge around different forms of partnership, different forms of collaboration, and also making sure we have longer term commitments for the type of change that we need. And I think the other thing which I think is absolutely critical is making sure there's a stronger alignment around the investments that are actually needed to make this change. This isn't a trickle down option. I think if you really want to get progress around gender equality and all of the areas that we're talking about, it needs to be given primary objective status and greater support, and really looking at local, that fundamental shift of power, not just in terms of addressing issues of gender, but also making sure that we have the nuanced understanding of the local context in all cases to make this work. And the political will. We are at a pivotal moment. I think it's possibly even a moment of reckoning, and I think we need to grab that.
Thank you, Peter. And with that, maybe I'll turn to Dr. Tina for your final thoughts on this.
Thank you. The lesson we learned from the COVID-19 situation is that in every crisis, society is more concerned with the immediate events of a crisis than to see people at the edges of society, such as women. Compared to Johan Gandung's theory, violence in the early days of COVID-19 pandemic, the government brought society to the top of the iceberg of violence and led society into the pandemic, allowing the voices of public health systems and politics to be at the center of the solution. The COVID-19 situation is blind by gender and lacks the gender lens. Raising the voices of women troubles such as the inaccessibility of abortion rights, the problem of female sex workers, domestic violence, and the problem of dismissal of female workers is not led by the government, but comes from assistance of a strong civil society. I would like to see the government taking more care about gender sensitivity. The gender sensitivity attention the government can do now is to hear the voices of the protesters led by young generation. The needs of women are already being discussed on the road by young feminist groups who fight for reproductive health rights, encountering a culture of rape, access to safe abortion service. But it turned out that the government has arrested the young feminist leader last Sunday. All of these feminists gathered peacefully in front of the government house. This is unacceptable. For me, urgent female empowerment in the current situation of COVID-19 is to ask the government to restore freedom to women and listen to their needs. Freedom and democracy now in Thailand are the most important solutions to gender equality, and it eliminates all forms of violence against women during the COVID-19. Thank you.
Thank you, Dr. Tinam. I think it's an impossible task for me to summarize this very, very extensive and rich discussion that we've had. I would love to just say that some of the themes that have come out are just a real focus on prevention and social norm change, institutional resilience, as Davinda was saying, integrated approach, as the report has been advocating for, and long-term commitment, as well as really understanding what is true empowerment, and while also not forgetting the other vulnerabilities such as climate change. I will leave it at that, but I'm sure there'll be lots more discussion in the Q&A section, for which I will invite Julian to take over. Thank you.
Sujata, thank you very much. And look, so we've had some questions come through online. We might go to one of those first, and that gives the guys in the room a chance to ruminate on your own questions if you have one as well. So perhaps for the panel in general, Sok Chan has asked, during the pandemic, gender-based violence and sexual harassment has increased. What are your advices for interventions for all stakeholders?
Were the colleagues online were able to hear the question? Julian, you might have to come closer. I'm sorry.
That's all right, yes. I'll come closer to this device that we have. So, sorry, for the panelists, the question that we were asked by Sok Chan was, during the
Hi, panelists. Have we all been booted out?
Yes, I think we've lost connection.
Resources, you have policy, you have power, something like that. Please listen to female voices who are facing violence against women.
Thank you very much. Now, I think we've somewhat recovered our connectivity. So can I ask if our speakers can hear us again now? So I'm not sure if you dropped out in the middle of that response, but the question was in relation to the fact that during the pandemic, gender-based violence and sexual harassment have increased, and what would you recommend as interventions for stakeholders? So if you can all hear that, and I'm taking from your nodding heads that you can, perhaps we'll just turn to the group at large. Maybe Julianne, if you'd like to start in the response to that question.
Yeah, thanks. I mean, certainly, as I said, I think we recognise that gender-based violence, spikes in gender-based violence were one of the sort of early symptoms of what was happening with COVID-19. Domestically, the government here in Australia announced a $150 million package. This was way back in around about April, May last year, designed to ensure that we kind of bolstered and supported our existing provision of services for domestic violence here in Australia. So things around assisting our hotlines for gender-based violence. We have a 1-800-RESPECT is the phone number that people can call in a circumstance of gender-based violence. So funding for those sorts of issues, continuing to ensure that. Again, through the aid program, it was really looking at, well, what did our partners need? Because I mean, we work very extensively with civil society organisations, and it was clear when we didn't have international partners who were able to continue their work in certain countries, we really did rely on civil society organisations to continue to provide essential services on things like gender-based violence. So making sure that those civil society organisations had things like PPE, that they were working in environments that were COVID-free as much as we could sort of create that those were the sorts of issues that we really did sort of focus on, which are very sort of practical things that you could do, during COVID to support ongoing provision of essential services. That said, I mean, I think the ongoing work that we need to continue to do as a result of COVID and beyond is that important part about, the prevention work that we do on gender-based violence. And that's something that will be an ongoing issue for us into the future.
Thank you, Julianne. I'll turn to others on the panel. So maybe, Lorena, do you have any reactions to this question as well?
Yeah, thank you. Regarding to the GBV and the sexual harassment, we also found that and learned that there are increase of the number of the sexual harassment and the gender-based violence during the pandemic. So we would like to recommend for the government stakeholder at the national and subnational level to increase providing the services to the GBV victim as well the victim of the sexual harassment. So this should be online or create the digital platform that could provide the online service support or counseling support to the GBV or the sexual harassment victim. So they would able to call free without negative consequence, and as well as they could receive the counseling support from the service provider at that time. And another side, the service provider should increase the number of the technical skill to the service provider in the as an overall to ensure all the service provider they equip the capacity and technical enough to provide the capacity and support to the GBV service provider. And I agree that we should increase the number of the PPE distributed to all the health service provider to be able to provide the sensitive services to the GBV victim, as well as the Department of the Women Affairs I mentioned in Cambodia, but another country also would like to focus to increase the allocation of the budget to invest more human resource as well the services in the particular and specific area to be able the victim can access freely and available to all the people in the particular space. Thank you.
Thank you very much. And Dr. Tabinda.
Thank you so much. I just wanted to circle back to some of the conversations that we already had. And I think data has come up again and again, you know. I mean, especially in times of crisis, it's the data that we struggle with. What's happening and where is it happening? And that kind of shapes our decisions, you know, on how to program, how to reach out. I mean, what we tried to do last year here in partnership with Unfpa was to set up a multi-sectoral provincial coordination mechanism in Sindh and to see how the cases are being, our cases are being recorded, how the cases are being referred, and what kind of leadership is being given at the political level so that all the departments, you know, they consider a case of gender-based violence as their case because they have a role to play in it. Number two, complaint cells and helplines have also proved to be very helpful. So complaint cells and helplines need to remain functional in times of crisis, and they need to be supported to do that as well. And last, but not the least, once again, as I said, that women health providers could be the key here, because for women who are living within the communities who are not able to mobilize beyond a certain perimeter, you know, of their neighborhood, for them, their first source of information and their first recourse is a health worker or a healthcare provider. And these providers, you know, are a hope for the future. We can work with them and we can build their capacity, and they can then later refer the gender-based violence survivors to various, you know, services like legal justice, etc. Thank you so much.
Thank you very much. And last but not least, Peter, any reflections as well?
Look, I would agree with the other panelists' comments around the need to take a proactive rather than a reactive stand on this. The evidence and the data around increases in gender-based violence were both are being proven to be correct, but were also predicted. So I think it's around what are the lessons in terms of taking more anticipatory action, because, you know, we're only partway through this pandemic. But I would just make one further comment, you know, the predictable increase in gender-based violence is one risk that women face. And I think it's around making sure that we're taking an approach around looking at the other risks that we're anticipating to both protect women, but also both directly and indirectly in terms of the disproportionate impacts of COVID. And the example that springs to my mind is reflecting on the COVID situation in Papua New Guinea at the moment. We know globally that 70% of formal and informal frontline health workers are women, but we seem fixated as a planet around the supply of vaccines as opposed to the genuine costs of making sure that vaccines are equitable and that women have what they need through the vaccine program. And for every dollar we spend on vaccines, we need $5 in terms of broader health system to protect women health workers. So I think in general, it sort of reinforces what we've been talking about today. We can't take a siloed approach. We have to be anticipatory and also look at all of the relevant components here. So thank you.
Thank you, Peter. Look, now that's a very, I think, good note maybe to finish our discussion today. We are now at our time. So if I can just ask those in the room to thank our panelists for their extremely insightful comments and interventions today. Thank you very much.